My name is Amol Nergadkar. I'm the CEO of Patient Prism, and I'm here with Christina Villareal, who is from Dental Associates. She's their patient experience manager. And we've been talking about all things patient experience and how elevating that patient experience through their entire journey with your dental office, it affects so many different things, right? And we have obviously agreed that obviously every dental practice, whether you're one location, you're 1,000 locations, you need to focus on delivering exceptional experience to the patient at every touch point. How do you get started with this?
That's a great question. So I think the most important thing, of course, as I had mentioned before, is making sure that the leadership team buys into whatever improvements that we're going to roll out, and they have our back, obviously, and really, finding the right person, obviously, to do this and have someone designated that's going to follow through. And support, the doctors and everyone on the initiative. There's different things that we do at Dental Associates to support our objectives in getting, our whole teams to provide our patients a great experience. I'm really involved with, going to the clinics and meeting with the teams and the doctors and the hygienists and the assistants, and really focusing on their interactions with our patients. I actually do observations of our doctors and our teams, and I let them know, I'm not assessing any of your clinical skills.
Right.
I'm only here to look at the things that you can't see yourselves doing, your body language, your tone of voice, your interactions with your team, your team's interactions with the patient. It's so important that we are looking at what we do through the eyes of a patient. Because those patients are going to, go on social media and talk about their experiences and, let their friends know how amazing, their visit was with us. And so I think just really doing different things to monitor and find ways that we can improve will continue to help us grow as a company.
But at the bottom, I guess the most important thing, obviously, as company sets up its objectives and those objectives are aligned with the patient experience initiatives, you've got to find the right person that's going to do this and implement this.
Yes.
In an organization. Because if you just tell somebody else to do this as a side thing, it's not going to happen.
Exactly. And there are different things that we look at to see, how we're improving. Whether it's case acceptance or, the conversion of new patients. It's something that is so important to really focus on and have someone that's really dedicated to and is a cheerleader for. I mean, you have to be a champion for our patients because, they're not going to do it themselves. We get their feedback, but we really need to make sure that each and every person that patient has a touch with,
Right.
that interaction with, is working to make their experience outstanding.
Right. And then in terms of, you said you do observation. Is any other specific things where you're giving them feedback or maybe changing behavior?
Absolutely. Yes, we do role playing with our front desk staff that answer the phone.
Sure.
We do in-person role playing when someone walks in, and our training team does over the phone.
Sure.
Role playing as well, where we can't look at each other, got to be back to back. It's so different. Are you smiling when you're answering the phone?
Right.
Those type of things. So there's different things that we do at our company that really to be more influential and really help everyone understand, instead of throwing out some memo that says, okay, from now on you're going to do this, and this. No, you got to go in and be a part of what they do and
Right.
really understand all of their responsibilities and their role, and just help make us better. We're one. We all work together for the same goal,
Right.
and that's to take care of the patient.
I mean, these are great tips. I mean, I hope a lot of folks get to listen to this, because if you are of any size, I think the important thing is to, I guess, after you've identified that you need to work on this, identifying the right person that's going to be separate from your clinical and even non-clinical folks, and having them really evaluate, analyze, and respond and proactively train your members to deliver a great experience is going to be very crucial for meeting a wide variety of objectives that you have for the company. Again, at the end of the day, we want to have increased revenues, improved EBITDA, more patients, more case acceptance. All of that stuff is impacted by this one factor, which is delivering the wow patient experience. So thank you so much for this conversation.
Thank you, Mom.